Everyone, everywhere, is at risk of contracting periodontal disease and interproximal caries in their lifetime. Now, that's a pretty big deal. Even though flossing is a simple, cost-effective technique that can greatly lower that risk of periodontal disease and interproximal caries, a lot of Americans don't utilize this widely available preventative measure. For your own sakes, I hope that today you'll all commit to really floss your teeth each day. I'll share with you why this essential oral health element is so often overlooked, the dangers and the eventual costs of not flossing, and the great benefits of establishing a flossing habit in your life. As a dental assistant and dental school applicant, I have shadowed dentists for hundreds of hours, and so am uniquely qualified to talk on this topic, and I've really seen the effects of those periodontal disease and interproximal caries that result from not flossing. But why does this really matter? You know, most Americans don't floss their teeth, so what? Well, one reason is we're getting older. Life expectancy in the United States is increasing. As we're getting older, we have to have our teeth for even longer. It's not as fun when you lose all your teeth by the end of your life and you have to deal with dentures every day. Now, in a study in 2008, run by Doctors Corby, Briesbach, and Bartzik, they found out that most people who don't floss regularly have statistically shown an increase in that individual's risk of interproximal caries, root canal infections, and periodontal disease. So what happens is when you eat food, it gets stuffed down in those little sulci between the teeth. It gets down into the gums, and if you don't floss it out, then bacteria can start to break down that food. They can proliferate there. They can release acid, which leads to cavities. But if they proliferate or multiply too much and too fast, then you start to have that's an infection. That's an infection right there. That's the definition of an infection. The pressure can cause the tissue to become inflamed. That's your body's response to that kind of infection. But that inflammation can lead to the regression of the bone because your body is trying to relieve the pressure. That growing bacterial colony is creating pressure on the tooth and the bone. So the body's solution is to literally stimulate the osteoclasts to start to break down your jawbone. And those periodontal ligaments connecting the tooth to the jawbone start to break apart, which is why it's called periodontal disease, because that periodontal ligament starts to break apart and that tooth will start to get wiggly, and then it can have to be extracted at that point. There's not a lot that'll make that bone grow back, and even then we don't really know how to stimulate those ligaments to regrow. So you gotta floss, or else you'll have to deal with that. So how can we avoid those risks of periodontal disease, root canal infections, and interproximal caries? You know, starting to floss after a lifetime of not flossing, that can be really difficult. One might start this process by sharing a goal with a friend, getting an action partner, or an accountability partner. You share your goal with your friend, and you ask them to follow up with you on it. Another solution might be to set a daily alarm on one's phone. I have to set a lot of alarms on my phone to remember everything I need to get done during a day. And one might even continue to educate themselves on the many studies that are out there that show the definitive benefit of flossing and the blatant detriments of not flossing. Another solution might even to be writing out your goal to floss every day, to actually do it on a piece of paper and put it on a place you'll see it each day, maybe right there on the bathroom mirror. What I've found to be most effective to begin a new habit is something I've learned from the BYU Idaho Wellness Center. It's called habit stacking. This entails identifying a daily habit that you want to develop and then attaching that new habit to a habit that you already have established in your life. So here's how this might work. Let's say I have a daily habit of gargling with mouthwash, as I do. If I don't have a habit of flossing daily, I can just attach that habit to gargling mouthwash. So I'm just going to tell myself, all right, right before I gargle with mouthwash, I'm going to floss. I might even put those little flossers right on top of that mouthwash so that I have to pick up the flosser every time that I'm going to gargle. Perhaps you have a daily habit of taking a nap after lunch. You might put that floss dispenser right on your pillow so that before you take your daily nap, you get that floss out of there. What's helped me personally was to put the floss pick just on top of my toothbrush, that I'd have to pick up the floss pick right before brushing every day. That's how I used habit stacking in my life. Now, many people decry flossing because when they floss, it hurts and the gums bleed for the first week or two. Now, in a study done by Doctors McGuire, Sankara, and Sullivan in 2022, very recently, they found that the bleeding and discomfort is caused by a lack of flossing. So the food gets underneath the teeth, into that gums, and then there's bacteria there, and that small pressure will cause a small bit of inflammation, not as serious when we're talking about periodontal disease, but that microinflammation will cause the gums to be more sensitive and to become red and puffy. But in a study done by McGuire, Sankara, and Sullivan in 2022, they found that after implementing that daily habit of flossing, the gums are not so puffy anymore, and they actually return to a healthy pink color instead of being very red. Now, what might this look like? Let's consider what might happen if you adopt that daily habit of flossing. So imagine that you stack your habits, you set an alarm on your phone, you get an accountability partner, or you do whatever you have to do to start flossing daily. Your gums, they'll stop bleeding, they'll have a healthier appearance, they'll look pinker, you won't have to deal with periodontal disease, you won't have to worry about all those doctor's bills, and you'll be able to eat your own steak dinner with your own teeth well into your 70s. But let's say you don't floss for a week. You're eating some popcorn, a little popcorn kernel gets stuck down in there, bacteria introduced just naturally into your mouth can start breaking down that beta-glucose polymer and proliferating on the cellulose of that little popcorn kernel that got stuck down there. Your gums will respond to the proliferation of the bacteria that's causing inflammation, and the gums will begin to recede. The bone will also begin to recede to relieve that pressure, and the periodontal ligaments will fall apart, the tooth will become loose, and it will have to be either taken out, or if it's caught early, you'd have to get root canal treatment or some other expensive procedure. That wouldn't be very fun for anybody. So if you want to enjoy those teeth well into your old age, what are you willing to do about it? If you're not willing to make a daily commitment to flossing, well then, what have you been doing listening to this speech for 8 minutes? Flossing daily has been clinically shown to reduce the incidence of those painful and expensive oral procedures. In a study done by Drs. Hujol and Kunkar-Cruz and Bainting in 2006, they found that flossing daily is a cheap and quick procedure that can improve the aesthetic of your smile and the overall health of your teeth, reducing that incidence of root canal treatments and fillings in the interproximal regions. So, commit to make a change today. If you don't floss daily, link it to another habit with that habit stacking. If that doesn't help you, try any new strategies and do whatever it takes to help save your teeth.